Hey guys, Dr. Michael Derry here today. And so I'm a physical therapist and so is Clara here. Every day we treat lower back pain, and sometimes we get those clients who have hip and lower back pain. And so I want to go over through that a little bit today, some stretches that can help relieve hip and lower back pain discomfort. And Clara, go ahead and stand up, turn around here, turn around. So hip and lower back pain typically looks like in the lower back, but can radiate off into the glutes or even wrap around a little bit. And some people just complain that like this whole area is kind of bothering them. So when we treat these folks, you can turn back around. When we treat these folks, we want to hit all of those areas. So today we're going to go over stretches for the front, for the back, and the lower back, and kind of hit all of them just so you can help find some relief in that area. Again, this isn't a one size fits all. Find those 2 or 3 that feel really well for you and hang with them and just use them throughout the day for your relief. The dosage, so how much to do it to have some relief. We're going to start off with what we have found in the clinic to be really beneficial, but look in the description, you'll see reps and sets associated with it. But this is for form, so we can improve how you feel. So we're going to go over the nitty-gritty details about 6 stretches for hip and lower back pain. Let's get going and hang with me. Okay, so the first 2 we're gonna go over here are the hamstring and piriformis. These muscles are in the back of our legs and our hips that kind of attach in the lower back area and usually feel really, really good when we stretch them. So let's start off with the hamstring. So she's gonna straighten one leg. She knows what she's doing. She's gonna grab behind her knee with both hands just so you can support. So the key here is you wanna relax the front musculature so you can see that her knee is kind of just dangling there. This is safe if you've had a knee replacement or knee discomfort, and she's just going to kick up until she feels a little stretch back here and then hold it for just 1 second or so, then back down. Now, admittingly, this isn't my favorite one to do. The hamstrings sit in the back and they can feel really stiff when you've had lower back pain and just achiness, but we're going to utilize it without any equipment today for this particular stretch. So this is what she's going to do. So she's going to kick up, feel that stretch. Secondary benefit is that her quad's going to get a little bit of a workout. It is what it is. Kick, kick, kick. So now we're going to go over the hamstring stretch. So the hamstring sits in the back of the body. It's a big muscle that goes from our buttock all the way to the back of our leg, but with tight hamstrings, you could definitely have some lower back or hip stuff go along with that. And so we want to loosen that area up. And one of the favorite ways to do it is with a strap. And so we use this stretching strap that has these loops in it. It's a nice nylon strap that isn't going to give. It's not stretchy at all, so you can use less arm force and you can get the most out of it as you can. So we're going to loop this around her foot, and this just goes around the ball of her foot. She is going to grab the loop range that feels well for her. And she's going to straighten that leg. And then what she's going to do is she's going to pull up towards her face. And then she's going to feel that good hamstring stretch. And you can probably even see the hamstrings poking out here. And they start in the butt and they end at the knee. And you want to stretch there. And what you'll see Clara do here is she's going to rock into that range, in and out. In and out. Where you want to feel that stretch is right here. You want to feel it into the meat. Hamstrings are huge, huge muscles, and so you want to feel those hamstrings loosen up. Again, the dosage is important, so look in the description for that. The hamstrings are a great, great area to stretch out. We typically feel a little stiff in the hamstrings, especially if you've been dealing with some hip and lower back stuff for a while. So that's a hamstring stretch, one of our favorites. The strap is well worth it because you can use it forever. Now we're going to move right into the piriformis. The piriformis is that big old muscle that the sciatic nerve comes near and it attaches to our lower back and hip. And so she is going to bend up one leg, cross it over here. The key with the piriformis here is that you want to get this hip and knee above 90 degrees. And so she is going to have like a figure 4 position. She's going to grab behind her knee here. Good, and then she is just going to try to pull up to where she feels a little stretch into the glute. Should be right in the meat of the buttock, and so you can enjoy that great stretch into here. And so she can pull up as hard as she would like, and then relax, and push up, and relax. Clara doesn't have the loosest hips in the world, so she can feel this stretch. Good, and so that's the piriformis stretch. Again, you don't see a long, prolonged hold. I don't know if you could see it, but she is doing more of a rocking motion getting into that stretch. So that's a hamstring and piriformis, but I just led to our next one, which would be the hip flexor stretch. So she's gonna get on one knee. Again, she's doing this on the table, but please do it on the floor. She's gonna be in a kneeling position. Good, let's switch it up so they can see the other side. Perfect, so the key here right? We're doing hip and lower back pain stuff. So we want to feel it in the front of the hip. The last two ones just worked in the back. She is going to shift she's going to tighten up her belly a little bit and then shift her weight forward. It is not a lean forward. It's not that. She's going to be nice and tall and shift her weight forward, and she's going to do a rocking motion. She's good. Stretch in the front of the hip, and that's where you want it, right? The hip flexors are very deep, and they originate in your lumbar spine at multiple levels. So when you can really dial this in, it feels really good. So she has this great kneeling stretch. She's shifting her weight back and forth, and she's enjoying the awesome stretch. Again, no holding, right? There's a trend here. We don't want to hold. We want to get into that range and come back out of it. Get into the range and come back out of it. Hip and lower back pain can be a booger, and it can impact a lot of our day. Loosening up your hips is very important. There's a reason why it's called the lumbo-pelvic complex, and that's how we learned it. So we treat it that way. We treat them together. Very good. So she's enjoying that nice weight shift forward. Okay, now she's gonna get on her hands and knees. Moving into the hands and knees, we're gonna go right into an angry cat. So we're just gonna get the top part of the cat camel. And so she is going to arch up and then back to the middle. So some people with hip and lower back pain, they don't like to go down into extension, where this is flexion, so a little bit more flexion, a nice roundedness. Extension is the opposite direction, and sometimes that doesn't feel awesome to get into. So when we're loosening things up, and we'll work our way there, but we can oftentimes start with just the flexion component, or angry cat. And so she is not holding, she is just diving into that new range and then coming out of it. Nice flexion based movement that typically feels very, very good. Feel all right? Great way to loosen up the upper back, lower back, and hips. Amazing, amazing stretch. Okay, so this next one, she's actually gonna get standing here. So we've attacked a lot of the back body. Now we're gonna hit the front body. We did the hip flexor stretch, but we're gonna hit the quad now. So she's gonna be standing to her side, and she's gonna grasp her foot. Yep. And she's gonna stay nice and tall and give herself a good yank. And then I know she's really trying to fight that tilt there, and getting that hip or that quad stretch in the front of the leg. And what you wanna do here is just do that nice pull. So she's gonna relax, just relax it an inch or so, and then pull it back. And relax an inch or so, or pull it back. Please stand next to something that is sturdy. You don't want to feel like you're losing your balance. You're looking to loosen up the front of your leg. So she's going to continue pulling here, pull, pull, pull. Awesome, great form. She's a physical therapist. I would expect her to have great form, but the biggest things we want to look for is a big stretch in the front. Now, if you've had ankle stuff or knee stuff and you just can't get into that, or maybe you just lost that range over time, that's okay. There's other ways to get through it, and I have more content in the channel that you can look at and reference. Okay, last one here. We went through 5. We're gonna be on her belly. So we're just gonna loosen up the lower back. Right, we're looking for hip and lower back stuff, and this is the prone press, right? This is a classic exercise that we use to help loosen things up. Now, we talked about going into extension can be uncomfortable, but we want to focus on just being aware of where we are in that moment. So more range of motion isn't necessarily better. We just want things to loosen up. So hands, you're gonna be up a little bit higher. And what she's going to do here is keep her glutes nice and relaxed, and that she can press through her hands to get that motion in her back. So go ahead and press up, and right there. So some people may only be able to go that far, and that's absolutely okay. She goes back down and then presses up. And I just challenge you to work into this over time. Extension of our spine is a very normal pattern for our back to do. We can arch back a little ways, not nearly as far as we can go forward. And that's because our spine is built to protect our spinal cord. And so we want to protect that region, but also maintain that ability. And we don't want to not lose the ability to go backwards, right? So loosening up that spine, she's gonna keep her glutes relaxed so she can feel that into her lower back. Prone press is great. Again, breathing out at that range that you feel like you have to stop, that you feel it in your lower back is great. If you start to notice stuff going down your leg or anything like that, that's not what you want to do. The purpose of this stuff is to loosen up your hip and lower back. And in patients that I've met that have really, really super stiff hips that sit a little bit more in their day than they would like, they even feel a little bit of a front hip stretch when they do this. So you may feel that too. All right, guys, so we've went over 6 amazing stretches, mobility exercises that we often use to treat hip and lower back pain and discomfort that just helps improve the mobility and how that area moves and feels. And like I spoke about earlier, you may not do all 6 of these right. You don't necessarily have to do that. And even when we work with our clients, we don't end up doing all of that every day for that relief, but find those few that work well for you. And if you guys like these exercises and you like us going through them, please subscribe. We'll put more content out there related to that. That would be greatly appreciated. If you guys have any questions or concerns, just leave them in the comments. We'll get to them. We'll answer those questions so you are super clear about what things should feel like and maybe give you some tips on how to improve it. So really appreciate the support. And as always, guys, stay healthy, keep moving, and take care of yourself.
Good.